Welcome everyone. Good morning, good afternoon, good evening, wherever you are in the world. And thank you for joining the NGO Major Group side event today at the beginning of the High Level Political Forum in 2021. Please note that for this webinar, we will be recording and interpretation is available for the session. You would need to pick your preferred language option by clicking on the icon, the globe icon that you see located at the bottom of the Zoom window. And please do select English if that is your preferred language, since there will be some participants speaking in French or Spanish, and you will need the interpretation for that. In the second part of the session, we will have time for questions. So please use the hand raise function or the chat. Please place your comments in the chat box, and we will come to those questions in the second part. Buenos días, buenas tardes a todos y a todas. Gracias por unirse a esta reunión virtual del grupo de ONGs en el foro político de alto nivel. En esta sesión hemos habilitado la interpretación de idiomas. Pueden elegir su idioma preferido haciendo clic en el icono del globo terráqueo que está en la parte inferior de esta ventana de Zoom. En la segunda parte de la reunión tenemos tiempo para preguntas. Si quieren hacer alguna pregunta o comentario en cualquier parte, pueden utilizar la función de mano alzada o hacer un comentario en el chat. Bonjour et bonsoir à tous. Merci de vous rejoindre à cette réunion virtuelle du groupe des ONG au Forum politique de haut niveau. Nous avons activé l'interprétation linguistique pour cette séance. Vous pouvez choisir votre langue préférée en cliquant sur l'icône représentant la Terre au bas de cette fenêtre de Zoom. Si vous souhaitez poser une question ou faire un commentaire à tout moment de la séance, vous pouvez utiliser la fonction main levée ou bien faire un commentaire dans le chat. Dans la deuxième partie de la réunion, nous aurons le temps pour faire des questions. Merci bien à tous. Nous allons commencer. And so I will switch back to English, and I'm very glad to be able to welcome you once more to the NGO Major Group side event. We have a very dynamic and varied panel for you today, and we are really glad to be able to share some ideas at the beginning of this high-level political forum on the future that we need for civil society, the future that we need for a better future for so many parts of the world, and looking in particular at community voices from different parts of the world that will be considering how to build a healthy, green and just recovery. We know that the recovery is one of the main themes of the HLPF this year, and we're looking forward to a really dynamic discussion. So before we get started and before I introduce our keynote speaker, Ambassador Frutiger, I wanted to get a little sense of who is in the room. So if I might just take 1 minute to do a poll, we're just going to quickly check who is actually in the room today as a way to create some interaction, and so that we might tell Ambassador Frutiger a little bit of who is here. So I'm launching, I'm launching the poll now. You have 1 minute. Please, hopefully you have the poll open in front of you. Please fill in the questions. Which region do you come from? Please let us know which region you come from. And then secondly, is this your first time at the HLPF or not? Have you been here before? Thirdly, what is your top priority for the recovery? And I know this is tricky because many of you work on more than one area, but we've highlighted health, gender equality, climate, nature, and social justice. Of course, these are not exclusive. There are many other key issues, but these are some of those that have come up through our discussions so far. And finally, are you a member of the NGO Major Group? Just 5 seconds more until we get to a minute, and then we'll close the poll. Thank you very much. So I'm going to see if we can share these results with everyone. Hopefully people can see this on the screen. So we do have a very diverse range of participants, quite a few from North America, but also Latin America, Sub-Saharan Africa, Europe, Asia, those joining in later time zones in Asia, thank you for making the time. It's getting late. And even from the Pacific, where it's already much later. You can see here that 67% of those on the call so far have joined the HLPF before, but then 33% are coming for the first time. And in terms of priorities, quite a good mix here, as you can see, social justice being high, but that of course includes a number of sub-themes within it. Climate, the second highest, and then health, gender equality, nature, all also scoring highly here. And then finally, 75% of those on this call are members of the NGO Major Group, but we also have some newcomers, 25% who are not yet members. So that just gives a little flavor of who's in the room. Thank you so much to everyone for filling that in. Coming back now to our keynote speaker, I'm absolutely delighted that we have such a key member of the Swiss delegation joining us today, Ambassador Christian Frutiger, who's the Assistant Director General from the Swiss Agency for Development and Cooperation, who's going to give us the opening keynote remarks. Ambassador Frutiger, the floor is yours.
Thanks a lot, Oli. Ladies and gentlemen, chers collègues, queridos amigos, it's really a great pleasure to be here today and to be able to talk to you at the NGO Major Group's side event. These are really strange times. There is no need to repeat that. So let's remember a few things. The 2030 agenda has been designed as an integrated set of 17 interlinked goals. They're rooted in the idea that human development and well-being cannot be achieved without simultaneously safeguarding and investing in nature. Otherwise, development gains would be short-lived and unequally distributed. Yet, before the COVID-19 pandemic, we have collectively failed to live up to this idea. Climate change, environmental degradation, and loss in biodiversity were on a steady rise. So recovery efforts from the pandemic now call for inclusive green solutions that drive economic, social recovery, but also protect against future shocks. We can only achieve this by putting people's well-being and a healthy planet on equal footing. However, recent data from the OECD shows that only 17% of the total sums so far allocated in the COVID-19 economic recovery are aimed at environmentally friendly measures. So we can do better than that, and we must do better than that. Beyond the adoption of such green solutions, we must ensure that our recovery measures are informed by local needs and knowledge. A fully integrated approach to COVID-19 recovery and sustainable development requires multi-stakeholder partnerships that encompass the whole of society. The voices of civil society organizations must take center stage to promote and invest in local solutions that complement international efforts and investments and can make them more effective and sustainable. Existing inequalities have been accentuated by the COVID-19 pandemic. Recovery efforts, as well as associated policies and strategies, must therefore focus on the needs of those who are the most at risk of being left behind. A key to prioritize the needs of these groups are data. Data is superpower. On the one hand, it allows policymakers to set priorities, take evidence-informed decisions, and implement better policies. On the other hand, it is a strong tool for communities to engage in policy processes and ultimately hold decision makers accountable. The availability of relevant, timely, and actionable data is essential for low and middle income countries. Quality population data can make the most vulnerable people visible for policy decisions. Yes, yet availability of such data remains a challenge, as well as the necessary analytical capacities and tools to manage it and turn it into insight and innovation. Consequently, we must prioritize our investments in national and local capacities for data literacy and support communities in knowledge sharing. Data will also help us make the case to promote investments towards more sustainable food systems. that will contribute to healthy food and planet and offer better life conditions for all, especially for smallholder farmers and vulnerable consumers. We hope that the coming Food Systems Summit will be the opportunity to transform our food systems so that they become more sustainable, inclusive, and resilient. We need all stakeholders, in particular civil society organizations, to contribute to this goal that will help achieving most of the SDGs. In order to build forward better, we need new and inclusive partnerships, innovative technologies, and an integrated approach across all SDGs. So I really look forward to the discussions today, to the diverse inputs, and to the conclusions. So very happy to be here and looking forward to the talks in the next few minutes. Many thanks, and back to you, Ollie.
Thank you so much, Ambassador Frutiger. That was extremely helpful. And I think you've highlighted some really crucial points in terms of partnership working, in terms of the key need for data to understand where the gaps are, and the importance of linking together social and environmental justice as part of the recovery. I realized I didn't fully introduce myself actually earlier, so I'm Ollie Henman, one of the OPs, the organizing partners of the NGO Major Group, and we also have quite a number of our regional organizing partners who will be speaking later on. So now, in order to take us further in this conversation and perhaps to pick up on some of the themes that have been highlighted already by Ambassador Frutiger, we have a very diverse mix of speakers from across the membership of the NGO Major Group who have been selected through an open discussion and promoted and suggested through our own internal processes. And it's really shows the breadth of knowledge and experience across the NGO Major Group. First of all, we have Fatimatou Sall, who is the president of the Association of Young Water and Sanitation Professionals of Senegal. And Fatimatou is based in Senegal with close ties to her community. She can speak about the impacts of COVID-19 linked to the relevance of a One Health approach and the key importance to the access to safe water and sanitation for human and environmental health. Dr. Sall also holds a unique doctorate in geography, specializing in ecosystems and the environment. So Fatimatou, I believe you have some slides, which I will put on the screen now, and then I'll pass over to you.
Merci beaucoup, Oli. Bonjour ou bonsoir à toutes et à tous. C'est un plaisir aujourd'hui d'être là avec vous. Donc, je reviendrai un peu sur la relation eau santé pour montrer les liens qui existent par rapport à ce contexte de pandémie, mais également en prenant en compte cette perspective One Health, santé de l'environnement, santé humaine et dans une moindre mesure de l'animal, en perspective également des politiques de résilience post-COVID-19. Next slide, please, Oli. Voilà, donc on parlait de la vulnérabilité des populations par rapport à la pandémie de COVID-19 sous une perspective au assainissement et hygiène. Donc, vous conviendrez avec moi que les inégalités d'accès à l'eau entraînent des inégalités par rapport à la santé, dans la mesure où l'eau et l'assainissement constituent des déterminants de la santé environnementale et de la santé humaine, et qu'il y a plusieurs maladies qui sont liées soit au manque d'eau, soit à la mauvaise qualité de l'eau, ou bien même à la présence de l'eau du fait de la dégradation de l'environnement. Next. Alors, pour revenir sur ça, là, vous avez quelques exemples de pratiques environnementales qui renvoient à des comportements à risque dans la banlieue dakaroise, qui est la capitale du Sénégal, une commune dénommée Médina Gounass, où l'accès à l'eau est vraiment problématique, même si nous nous retrouvons dans la capitale. Il n'y a que 43% des populations qui ont de l'eau courante dans leur domicile. 18% utilisent des bornes, 28% autant pour moi, utilisent des bornes fontaines, ça veut dire des robinets partagés au sein des communautés, et 27% de ces populations utilisent de l'eau tirée directement de la nappe à travers un mécanisme de pompage sans traitement. Next. Parallèlement à l'accès à l'eau, l'assainissement également est assez problématique. Si 95% des ménages ont des installations d'assainissement chez eux, il faudra reconnaître que le dispositif est assez sommaire et que les populations font recours à de la vidange manuelle pour plus de la moitié et les bouts de vidange sont déversés comme ça au niveau de l'environnement, ce qui contribue, comme je l'avais mentionné tantôt, à la dégradation de l'environnement parce que soit les bouts sont versés au niveau de la rue, soit à travers un puisard ou bien au niveau des concessions, mettant les populations en contact direct avec ces dépôts. Donc, au moment où le Sénégal était confronté à la pandémie de COVID-19, il y avait un inégal accès à l'eau et à l'assainissement. Des communautés entières sont en rade par rapport au progrès en matière d'accès à l'eau et à l'assainissement. Et ces communautés également sont parfois utilisent de l'eau d'une mauvaise qualité parce que, comme je l'ai mentionné tantôt, plus de 30% de ces populations utilisaient de l'eau directement tirée de la nappe sans traitement. Or, parallèlement, les bouts de vidange sont déversés au niveau de la nature, ce qui entraîne une contamination de ces eaux. Il en résulte également une dégradation de la qualité de l'environnement et la création de milieux propices au développement d'agents pathogènes pour la santé humaine et également pour la santé animale. Next. Donc, face à cette situation, il faudra reconnaître que les populations, face à la pandémie, sont exposées à des lieux de prolifération potentielle du virus parce que certains projets de recherche ont montré qu'on pouvait retrouver le virus au niveau des bouts de vidange. Or, comme on le voit à travers cette illustration, vous voyez des enfants qui sont à côté d'un site de dépotage de ces bouts, mettant ces derniers au contact des microbes et du virus. Outre cela également, du moment que l'accès à l'eau est très problématique, le respect des mesures barrières ne pouvait pas se faire, notamment le lavage des mains, du moment que les populations n'ont pas soit accès à l'eau ou bien l'eau dont ils ont accès n'est pas toujours de bonne qualité. Et ceci également en termes d'inégalité, en termes d'exposition, exposer les communautés de façon générale, mais également les couches les plus vulnérables, notamment les plus jeunes, ce qui avait conduit à une fermeture des écoles, outre pour pouvoir respecter les mesures de distanciation sociale. Donc, il faudra reconnaître que cette question d'accès à l'eau et à l'assainissement a entraîné une vulnérabilité accrue liée à l'inégal accès à l'eau et aux pratiques d'hygiène d'assainissement au sein de ces communautés. Donc, face à ces situations, il urge de multiplier les efforts pour accélérer l'atteinte de l'ODD 6 afin de ne laisser personne en rade dans les stratégies de résilience post-COVID-19 et que cette question de l'ODD 6 doit également être une question qui doit être traitée au même titre que les autres objectifs de développement pour répondre au rétablissement et à la résilience post-COVID-19. Merci beaucoup.
Merci bien, Fatimatou. Extremely useful and I think very insightful in terms of the reality that so many people are facing on the ground and the interlocking challenges presented by underlying inequalities and now further exacerbated by the COVID-19 pandemic. I think you've really shown very concrete and tangible challenges, and hopefully we, working together, can find ways forward to address some of those. Our next speaker now will take us a little further east. We have Naeem Abbas, Advocacy Manager from the Brooke in Pakistan. Naeem manages the policy and advocacy initiatives for Brooke in Pakistan, looking particularly at animal welfare. He has a master's in sociology, and his key priorities include policy analysis, budgeting, implementation, monitoring, advocacy, and in particular, he'll be looking today at the aspects around human and animal health and how those are interconnected. So, Naeem, over to you.
Thank you, Abid. Yeah, most of the stuff my honorable colleagues have already explained, and I will continue from that. That humans are living in a world where animals are closely connected with them, having an interaction, and then both of them are getting influenced by the environment. If we talk about Pakistan, we have more than 65% of the population dependent on agriculture and livestock. So this can tell us a scale that how much people are involved with the animals. COVID-19 has not only influenced humans, but animals too. According to a study, during lockdown, half of the farms reported feed shortage due to lockdowns. 43% farms have witnessed 7.5% shortage of feed intake. 71% veterinarians at farms failed to gain access to essential veterinary medicines, hampering the treatment of sick animals. And I must say, we should know that around 75% of emerging infectious diseases come from animals. The animal milk, meat, and other products are in human use. A weak animal health system may lead to sick animals, and as a result, human may suffer. So some of the diseases of animals, animal origin that are transmissible to humans, such as avian influenza, rabies, Rift Valley fever, and brucellosis, pose worldwide risk to public health that must be prevented and controlled. So this is just an overview that how humans and animals are having an interlocking between each other. The other example I will quote from the community is that uh, there are some industries where animals are working closely with the animals, with the humans. Bricklin is one of the industries here which is responsible to produce uh, mm, around 45 billion bricks annually with 20,000 bricklins. And uh, in the Bricklin, we have observed that around 13 million tons coal consumption uh, is there in the mines, in the bricklins. Diseases related to skin and respiratory systems have created a lot of problems for the humans and animals. Pakistan's annual burden of disease from outdoor air pollution is responsible for around 22,000 premature adult deaths, according to one of the World Bank reports. There are around 1.3 million people employed on BKs and around 200,000 working animals are being utilized in the BKs to carry bricks. So this, the second example also tells us that how humans, animals, and environment are interacting closely with each other. So if we look back and see when COVID started and countries and government and organizations made plans to address the issue, I think the animal health systems was not prioritized as it should have been. So if we want uh, to have a safer world and want to avoid these kind of pandemics in the future, uh, we should ensure that uh, animal health is also addressed along with human health, and an inclusive approach need to be adopted. We need to enhance collaboration of One Health experts, and integrated evidence generation is required so that an inclusive policy should be adopted to address environment, animal health, and human health issues uh, collectively, because these are all interdependent. Thank you very much. Oli, over to you.
Many thanks, Naeem. That was extremely useful, and I think you covered a lot of ground. Apologies to everyone if we lost the video there for a short while. I think there was something on the connection there for Naeem. So I've returned to the slide so you can see everyone's names in one place. So we've heard now from Fatimatou, we've heard from Naeem. Next, we have Sanjoy Hazarika, who's the International Director at the Commonwealth Human Rights Initiative. I'm sure many of you are familiar with CHRI. Sanjoy is extremely knowledgeable on human rights, a scholar, an author, a journalist, a filmmaker, and a human rights activist. He was also the founder director of the Center for Northeast Studies and Policy Research, and he is the managing trustee of CNES, which runs pioneering boat clinics on the Brahmaputra. So an activist as well at the grassroots. So it's a real pleasure that Sanjoy has joined us today and will be able to give us some insights on the human rights dimension for guaranteeing a just recovery. Sanjoy, over to you.
Thank you, Oli, Ambassador Frutiger. I don't know if he's still there, but fellow panelists and participants, I'm privileged to be on this major NGO group panel. You know, some time ago, an Indian magazine ran a report with a child on its covers. The child was swamped by smog and haze, and the title read, "I Can't Breathe." The photo took me back 37 years to the Bhopal gas disaster, which I had reported upon for the New York Times. The industrial tragedy at that Union Carbide subsidiary plant was a cataclysmic event that forced governments and the judicial system, corporates, regulators, media, scientists, civil society worldwide to develop new laws and regulations. These were as much about the criticality of sustainable development and safe industrial processes as about the value of life itself. And those weeks in Bhopal, I must say, shaped my view of the world, to technology and the environment. You fast forward to the first lockdown in India last year. While it impeded free movement, assembly and association because of the pandemic, yet we were surprised by some of its impacts on the environment. In Delhi, we saw blue skies after many years, and the air quality improved dramatically. The right to breathe free air in a sustainable environment that's built on adaptation, resilience, or respect for nature, as we've heard from our previous panelists, but also for each other. These are part of a public health and political process that constitute essentially the right to life. And it's critical that the voices of those who are most vulnerable to human rights abuse are included in decision-making processes, which often affect them adversely. And these include those in prisons and detention and who are highly susceptible to disease and death. The role of the judiciary is key to protecting the lives and roles of HRDs, human rights defenders, considering the risks that they and the media take in speaking out and speaking truth. The judiciary anchors critical rulings on the fundamental right to life. Therefore, issues related to the quality of natural resources must include the rights of traditional communities which depend on these for their livelihoods and their lives. And a post-pandemic world, if we are to think about such a world, needs to be anchored in a human rights subalternism, if I may call it so, one that emphasizes social, political, and economic rights and build on an active citizenry. CHRI has long worked on issues connected to the SDGs relating to transparent public institutions, accountability and good governance, access to justice reforms, the right to information, and a safe working environment for journalists, as well as on contemporary forms of slavery and human trafficking. I think that key issues which need to be priorities must include decongesting prisons, especially for the vulnerable and sick and those who've not even gone to trial. I think many of you would know that a majority of the prison population in numerous countries of South Asia have neither been tried or sentenced. This is really a gross violation of their rights, especially the right to life. The police, law enforcement agencies need to be more about rights upholding and law upholding than just enforcement agencies. They need to be more empathic to the concerns of those who are facing a crisis of health and livelihood and incomes during this pandemic. And technology needs to be made better use of for the work of courts and criminal justice system, as well as human rights, national human rights institutions and information commissions. Our experience shows that change has to be driven by local constituencies, as we've seen from Fatima's own experience. Campaigns and local regulators, officials and political leaders. And it must come with the inclusion of the vulnerable in policy making and implementation. It has to be interconnected and built on robust data and through engagement. It can't happen in silos, but across regions, across countries, because we must collaborate and learn from each other. And one thing this pandemic has taught us is that scale, whether it's of a response to a health emergency or a disaster, scale of outreach matters. And the challenge has been to link the national and international to the local, or vice versa. There are many good practices which exist, but the question always is, how do we scale them up? And I think at this time, that's something we need to be looking at very closely, because part of the answer lies in allocating enough financial and human resources and the extensive use of data and technology. Finally, I'd argue that the answer could also lie in extensive, inventive, and intensive use of that double-edged sword, media, traditional media and new media, including social media, to generate public learning and legal literacy, to improve the discourse, not worsen it, and highlight the need to protect defenders. It is also about changing the narrative by using social media with robustness and imagination as a force for inclusion, for representation, and good. Thank you.
Thank you so much, Sanjoy, and thank you for such a broad analysis of different aspects of rights and how we define those rights, as you say, as we come hopefully out of the emergency situation of the pandemic, and define how we guarantee some of those rights, the right to clean air, clean water, the right to a healthy environment, and how those can be further supported and guaranteed. So thank you so much. And hopefully we'll have time to come back to you when we have some further questions. So the final panelist now on this opening panel joins us from Norway, and she's the policy advisor, Ingrid Rostad, from the Norwegian Forum for Development and Environment, but also the co-chair of the equivalent to the major groups organizing system at UNEP, at the United Nations Environment Programme. So Ingrid has a huge experience in terms of both engaging within Norway, but also in the international engagement on the environmental UN Environment Assembly, UNEA, and she's also responsible for coordinating best practice around meaningful participation of civil society. So Ingrid, perhaps you can close us out and connect the dots between some of the different themes and how we might strengthen civil society voices even further in upcoming international forums. Over to you.
Thank you very much, and thank you for the invitation. It is so important that we as civil society actors and NGOs working across processes also coordinate amongst ourselves and cooperate closely, because that will strengthen our abilities to have an impact all over. And one of the things I was asked to talk about is the importance of civil society participation on all levels. And my colleagues who have spoken before me have touched upon very important points on that. As Fatimatou spoke about how vulnerable people are especially vulnerable to the pandemic, but also their analysis of how their problems. It is important to have that knowledge when we are also creating the solutions. And that is part of what I want to highlight today, is the importance of the knowledge that civil society can provide on local, national, and international levels, from the very concrete analysis of the needs of a community to fight a pandemic or to protect them from environmental harm, but also on the international level in terms of connecting the dots, learning from indigenous peoples, local communities across. And that is why I also so very fondly welcomed this invitation, because I think that we, as the Major Groups Facilitating Committee in UNEP, need to speak closer to our colleagues in the HLPF. And I would also like to draw upon what Sanjoy said on involving those who are most vulnerable to human rights violations in the discussions. And that will also relate to the other point, that is, it's not just about civil society sharing knowledge, but it's also about civil society having to be part of shaping policies. It is a lot of important work is being done as service providers across, but it also needs to be connected to the policy work so that we can take the important experiences from someone running a clinic in India into the policy level, both on national, regional, and international level. And some important points that often are under-communicated is that we also need ownership, because if we don't have ownership to an international agreement, then implementation will be more complicated. No one can think of all potential problems in implementing an agreement. So the more actors and voices that can be heard in making that agreement, the more possible to implement it will be. And it is also one of the things we are seeing now is, for instance, that we are having a big process on the plastics agreement, or working towards a binding treaty on plastics. But we are also seeing some potential challenges to local communities. But we are seeing possibilities from other discussions on the same, on very different topics, actually. We can learn from these armament movements on how to draft a treaty, or we can learn on how to put financing into the discussions in a very constructive manner. So these are some of the points we are seeing, and what goes, what is very clear in all of these points are that we need to have a wide range of civil society representatives in all levels, and we need to have a line of communication between the local level, the regional, the national, and the international. We who work on the international level need to be updated on the important perspectives from the local levels. And that is something I am hoping we can discuss further, how we can do that in a meaningful manner. But I am also looking forward to have a conversation on how we can learn from across the processes and raise the bar for meaningful participation in all UN processes. Because we are seeing that we have some things that we are very happy with in UNEP, and we have some things we are less happy with. And I am assuming it is the same for the HLPF and all other processes. So having these arenas to have a conversation and share is important. And I would also just very lastly repeat that we need to share our experiences. If someone has a very positive experience, we need to continue working on that. There's an aspect of solidarity. Some of us have very good access to our government representatives. We can share our perspectives quite easily. That, while others don't, that makes us responsible. It's not just a privilege, it is also a responsibility. We need to use the position we have to speak for those who are less privileged, but also to facilitate the meeting points between governments who are willing to listen and actors who have a message to bring. That's what I want to just finalize with before we move on to the questions, and hopefully we can reflect more on what has been said in that. Thank you.
Thank you very much, Ingrid. Thank you so much. I think you brought us to a very good point there, connecting the dots between a number of those previous interventions and connecting particularly on how we as civil society can work together, strengthening those voices coming from the local and national level to connect them and connect together into international forums, as you rightly highlighted, whether this high-level political forum, which is just starting, whether the UN Environment Assembly and other forums, the Human Rights Council, how can we make sure that our voices come together and strengthen each other and can be heard more effectively in those forums? So we've had a good range now of different interventions from different parts of the world, different experiences linking around these themes of a healthy, green and just recovery. And we'd now like to open it up to wider interventions. And I'd like to start, I know we have a couple of our colleagues who are also regional organizing partners of the NGO Major Group, who will have some specific insights coming from the regions where they work. I see here, for example, Kekashan, and I also see Kofi Kankam. Perhaps the two of you might like to start off the initial interventions. So Kekashan, would you like to start?
Sure. Thank you, Oli. And hello, everyone. My name is Kekasha. I'm the regional organizing partner for North America for the NGO Major Group. I'd just like to begin by thanking all of the panelists for their remarks today and for highlighting how inaccessible lifetime opportunities continue to remain for vulnerable populations that has also negated so much of the progress that had been achieved since the adoption of the SDGs, and also creating new vulnerabilities. So for instance, related to young people who now face severe challenges to continue and complete their education, drastically reducing employment opportunities, and of course, the shadow pandemic of the increase in gender-based violence, and another form of inequality that hadn't been considered before. I know one of our panelists talked about technology, but we now have the digital divide, with virtual and digital communication becoming the order of the day. As a consequence of the lockdowns, millions of people suddenly find themselves excluded. And once again, this is accentuated in marginalized communities, and especially the ones that do not possess the necessary infrastructures. Now, when you hear all of this, you would not necessarily think North America, because North America is classified as a developed region, with USA and Canada being Annex I countries. But this generalization is actually really harmful because it excludes the communities that are actually in need in North America, the global South within the global North, that are left behind because they're grouped in with the privileged communities and therefore their needs are not met. And with North America having the highest number of cases of COVID-19, it's communities of color and indigenous communities that are affected the most, primarily because of the racism within the healthcare system that already discriminates against them. And the pandemic just exacerbated that. And moreover, the digital divide also affects these very same communities disproportionately, meaning that the children don't have access to education, forced to drop out of school. And the worst part is that it's not really public knowledge, and that remains a problem. So as an NGO that works on the ground, my organization, Green Hope Foundation, we continue to witness this opportunity gap and divide every single day. So just to echo what our panelists have said today, what we really need to ensure is multi-stakeholder localized action so that we can actually reach out to the farthest first, ensure that the resources are there in place to help communities and everyone really to rebuild better, not just build back better, but forward better from the pandemic. And if we are to leave no one behind, if we are to have a sustainable and resilient recovery from the COVID-19 pandemic, as is the theme of this year's HLPF, then we cannot forget about these global South communities within North America. So we need to stop this generalization. We need the localized solutions. And of course, we need to understand that we have to address their unique lived experiences and the challenges of these communities. Implement localized actions, as all of our panelists have stated, and therefore allow them to thrive and live their lives with their full access to their human rights. Thank you.
Excellent. Well, thank you, Kekashan. It's wonderful to see you as always. And I think it's extremely powerful what you've highlighted, that those inequalities exist within and between communities in different parts of the world, including, as you say, in the global north. And it's an extremely strong point that so many communities are being left behind, even within countries that would appear to have the wealth to be able to look after their whole population. So thank you so much, Kekashan. I think we also now have Kofi Kankam, who is the regional organizing partner in Africa. Kofi, over to you.
Thank you very much, Oli. And greetings to all members and all the panelists. Africa's economy, like other parts of the world, has adversely been affected by the COVID-19 global pandemic, disrupting the day-to-day patterns of social and economic activities at all levels of the society. This enormous challenge has led to a dramatic loss of human life, production and distribution of food and fiber, accessibility to essential basic services at community health sector, as well as the work environment level. To a large extent, the pandemic's socioeconomic disruption has divested livelihoods of millions of dollars and threatened the continued existence of enterprises, with the small and growing businesses and the informal economic workers affected the most. The pandemic has robbed many of their incomes and jobs and drove millions of people into extreme poverty. The closing of air and land borders, trade restrictions, and confinement measures inhibited the normal business processes, limited production and distribution of basic and essential products and services. We in Africa has noted that although the pandemic has presented enormous challenges at all levels of the society, it also presents us with tremendous opportunities for reaching the 2030 agenda and also the Agenda 2063. The implementation of the Agenda 2030 will address most, if not all, of the challenges that the world is facing as a result of the current global crisis. And this will provide a stable and prosperous life for every person and ensure the mantra of leaving no one behind is achieved on the African continent. Advancing towards the realization of the SDGs will also add greatly to the global solidarity initiatives aimed at building back from the current crisis and prepare the world to build back better and stronger as the COVID-19 continues to rage in the post-COVID-19 era. The coronavirus outbreak challenges has not only affected Africa, but the world in general, and to provide strong responses from all actors, including the major groups and other stakeholders. And the pandemic has intensified the need for accelerated and unified action for Africa and the world we want. We are therefore calling for all of us to recognize and prioritize the need for transformative pathways and genuine partnership to save lives and forge inclusive pathways in ensuring no one is left behind. Thank you.
Thank you, Kofi. Thank you very much. And I think you've particularly highlighted some of those key challenges in terms of the financing of the recovery. And clearly, we've also seen some questions in the chat about that, highlighting that the gaps in terms of financing continue to be massive. And we know that many countries, unfortunately, including some of those countries that have traditionally been donors, are reducing their international solidarity budgets and also reducing the sharing of vaccines. And we know that that is essential in order to guarantee that just recovery. So we now have a number of additional hand raised. I see also Rosario, who's from our Latin American organizing partner. Rosario, I'm going to see if we can also bring you on. Please go ahead. Are you able to? Let me see if we can see you now. Rosario, are you able to?
Can you hear me?
Yes, we hear you.
Awesome. I'm just gonna turn on my camera. Awesome. Thank you very much, everyone, for this great panel. It's been very richful to hear you all and to learn about your points of view, but also the work you have been doing and all these main messages that you have sent to us. In the Latin American and Caribbean region, one of the main things that we have struggled with during this pandemic it's the increasement of inequality and violence. There is an urgent need for civil society organizations to be on the table, to be part of the recovery plans, but also to be part right now during the response, while other regions are advancing in order to move forward from the pandemic. We still are in the second wave in many of the countries. We still are working on the vaccination processes. We still are facing different challenges, and in some contexts even we are still on emergency situations in some communities. So definitely it's important that the civil society voices and the are able to join and make partnerships with other civil society actors and with the government in order to reach those communities, but also to address the current issues that perhaps are put on the side because of the response of COVID-19. The violence against women and girls have increased enormously in all of the countries. Girls, for instance, in Peru, Guatemala, and different countries are disappearing, even though we are with restriction orders and we cannot leave from home. They are still disappearing, and the number has increased. So definitely, it's important that we can act together, work together, but also this is also a call for member states and call for other stakeholders to open their arms, to open the doors for other stakeholders, civil society, because they have been working, reaching to those being left behind. And I think if we work in a partnership, or we work supporting each other, we are going to be able to move forward in the region in a better way, reducing these bad characteristics that we have, being the most violent and the most unequal region in the world. So I think that is one of the, well, that's the message. And definitely, I think this collaboration not should only extend to the region, but also globally. I guess it's time for a new globalization process, for a new and fair globalization process where civil society can take a place and support that these new partnerships, this new multilateralism. It's also good and also allows different communities and actors to have a say, to be on the table, and to also be part of the definition of their future. So thank you very much, everyone. It's been a pleasure to be with you today.
Wonderful, Rosario, and thank you for that reminder in terms of the highlighting that the pandemic itself is still very much ongoing in many parts of the world, and actually the huge disparities in the access to treatment and to the vaccine, which we're seeing, which shockingly, some of those governments in the global north have been stockpiling vaccines while many other parts of the world are yet to have real access to significant numbers. So it really has further highlighted that gap between those who are already left behind being pushed even further behind. So thank you for that reminder. We do have a few additional hand raised. So I'm going to try now to open the mic to, I think we have Ahmad Madavi. Let me see if this will work. Ahmad, if you're able to unmute now, please go ahead. We're not hearing you, Ahmad. Please.
Can you hear me, please?
Yes, go ahead.
Thank you very much and for the good session. And I am a retired professor and helping globally for toxic pollution reduction and regulation. And I also wanted to add about the big gap that you know about the financial support for NGOs. I am a retired academic, but globally active really to help. And for, I'm in the major groups also. Then I think we need support. For example, right now in Iran also, you know, the situation of vaccines and many other things. But we have big problems with intoxication by pesticides, you know, in many developing countries. That I wanted to bring this up, you know, that more attention and more help really for scientists to developing countries for going to events and talk. Thank you very much.
Thank you, Ahmad. Extremely useful. And I think those, I'm sure those questions will be picked up by Fatimatou and Naeem and others in just a minute. We have two more hand raised that I can see. So let me see if we can now come to Zakir Hussain. Let me see, are you able now to unmute, please?
Thank you, Oli. And it is really tough to organize such an event in this tough time. But from the local level, we are not hopeful enough to recover the situation. What damage has been done, it's done. Who has gone is gone. What we have lost is lost. But we have to prevent the future events and ongoing destruction. So as a UN body, UN should have to be more strong. And what we have seen with the vaccination, and we are left behind. All the developing countries, most of the developing countries, they are left behind. Since from the beginning, our Prime Minister Sheikh Hasina, she was advocating for making the vaccination or vaccine as a public good. But what we have seen that the vaccination, vaccine, the technology, the developed country, they are grabbing the resources from us as well. So as an NGO major group, as a member of NGO major group, it's not a coincidence that I am here. So we, as a local people, we have a certain design to do the things. But most of the time, maybe it is seen disorganized, but it's not. We are organized and we have proved it. So NGO major group in this critical time, I think that it should have to strong more vigorously. If we can proceed more vigorous way, so that we can think that we can change the scenario and the recovery will be possible, maybe not in 5 years, maybe not in 10 years, but in 20 years, maybe NGO major group will be in such a position that they can claim the voting rights in the UN systems. Thank you, Oli, and thank you all. Back to you, Oli.
Very interesting suggestions, Akia. Thank you so much, and thank you for your insights and your experience. Clearly, that that idea of giving greater rights to civil society is something that we've been campaigning for together for a number of years. Some of you will know that in this past year, with the support of the governments of Denmark and Costa Rica, there was a joint series of recommendations which we called Unmute Civil Society. And for those of you who haven't yet been part of that, I'll put the link in the chat, but it's precisely to identify steps to strengthen civil society voices at the UN, as you rightly say. One of those proposals, which is being considered, as I understand it, by the Secretary General of the UN, would be to have a focal point or an envoy of some kind who can champion civil society participation across the UN system. Because unfortunately, as we've seen, actually the spaces have been reducing in a number of different contexts. And we know that there are challenges, particularly given the digital nature of the meetings that have been taking place, to ensure diverse voices can be heard. So hopefully this meeting shows also to the UN that it is possible, and that we can actually have an interactive dialogue that does bring in those diverse voices, and we will continue to campaign with you for those stronger voices to be recognized by the UN. So I see we have 2 more hands raised. I'll take the last 2. We have Supe, and then we have Pradeep. So let me come first to Sue. I hope this will work.
Hi, can you hear me?
Yes.
Hi, thank you, Oli, for giving me this opportunity. I'm Pei, I'm from ActAsia. I just want to thank for all the speakers have been sharing with us about your experience. And I want to use this opportunity to really share with everyone about our experience during the pandemic working in China on the frontline operation. And I think the pandemic has brought us lots of lessons, particularly and challenges. And sadly, within this context, the racism towards, the Asian, because of the origin discussion, that has been increased. The hate crime in Asia has been increased under this context. And I think this is something is very unfortunate. Instead of use this working together and as a community and to overcome these. And the second thing I want to also address is the many people, particularly in China, where we work, for assess the event like this is even luxurious. Several of our contacts, they can't even use the Zoom because of the local restrictions. So in our world today, we work in very diverse background, but we often forgot that what we are using is a luxury for some of the region as well. And I think, from Brooke's hospitals, the regional director, he has addressed the One Health issue from, what we want the green future. And I think the COVID pandemic has certainly on the China ourselves, we feel it's very important we really address One Health between human, animals, and natures. And we could no longer still putting about the human health in the priority, but forget about the cause. It was our irresponsible behavior towards nature and environment. And that's what we have been trying really hard to grab this opportunity for people to understand the animal health on the ground in terms of the wildlife consumptions or factory farming, it will have a detrimental impact about human health. And I think this is a lesson we really should all remember from, this unfortunate event. That's why for the COVID in the future, I think the vaccine is very important, but I think how we could have prevention through the real vaccine is how we reflect on our relationship with nature and animals, and the prevention is to address more about SDG 12 on the ground, to talk about responsible consumption, and 13, 14, and 15. And that's what I want to share with you all. Thank you for the opportunity.
Thank you, Pei. Apologies, I was mentioning your second name. Pei, thank you so much. And thank you also for highlighting the digital divide. As you rightly say, a number of countries, a number of parts of the world where there isn't access to digital technologies and different challenges in terms of being able to engage digitally that further exacerbates those inequalities. So I think that's an extremely good point. And we know that in some cases, the UN for the HLPF this year, they've actually offered that groups may engage through the UN country offices. However, that only applies if you can reach the office, and often that would be in the capital. So we know that that still isn't yet sufficient, and clearly the digital infrastructure is another key gap in terms of inequalities. So we have Pradeep Baishak, and we have one last one. I noticed, Janosch, I know that you had also put some comments in the chat, so we will also come to you, but first to Pradeep.
Thank you, Oli. Thank you, friends. Great presentation. We at CHICAP Global Call to Action Against Poverty have started working on vaccine issues, and we have been pushing for trips wherever all around in doing rounds of advocacy with the governments. And what happened last is you can see the response from the G7 countries, where we're actually expecting something progressive from the rich countries on bringing this vaccine down to everyone through trips waiver and other measures. That essentially didn't have happen, and that in fact shows how much corporate capture or influence the corporate has on the governments. This is something, it's not new for any of us, but how gradually it has come out, and how helplessly we as common people have been watching it slipping out of our hands, despite repeated demands and pleads. This is not happening, and this is probably not going to happen. This is not only, this not only in also bad in terms of economics. We know how COVID has destroyed the economy, and how much more destruction it will cause to the economy. I mean, this is, I'm saying from the corporate point of view. Otherwise, we know the lives we have lost. So I think it makes the whole democracy, representative democracy, very fallacious. It's just, I am one citizen, I have one vote, that's all power I have. And I certainly know that I cannot change the system with my vote. So this makes a concerned citizen like me and you very helpless in the system that we are in. Point number two, I wanted to bring in one something from India, that India is actually doing good in terms of its measures in renewable energy, and they have come up with this report this time on SDGs. They are doing good. On the other hand, this is something which has come to the knowledge of the global audience, which has not come to the knowledge of global audience possibly, is simultaneously they have auctioned the coal blocks in very pristine areas, in the areas which should not have been violated from the environmental point of view, but they are doing it. So simultaneously, on one hand, you are showing you are doing great on clean energy. Simultaneously, you are doing something which is absolutely opposite and catastrophic to environment, people, communities, etc. So this kind of, I think Agenda 2030 now is being used more to show what you are doing, rather to, and simultaneously hide what you are doing and what you do not want to show. So that kind of safety valve aspect is something which I think is started happening. I mean, we have started knowing it. Maybe governments willfully are doing it without kind of expressing it, but we see that safety valve mechanism. I mean, that safety valve theory coming into Agenda 2030. Thank you, Oli.
Thank you very much, Pradeep, and thank you for the quite insightful points that you've raised there. I'm sure that a number of the panelists will come back to you on those points. So we are running out of time, so we have one final input, which I've seen has also been raised through the chat, and that is from Janos Stoika. Please go ahead. Hopefully now you can unmute yourself. Please go ahead. Janos, can you hear us? Janos Stoika?
Yes, are you, Mr. Oli, now you hear me?
Yes, please go ahead.
Oh, thank you for the opportunity. First of all, God bless for this team, and thank you for the opportunity. My name is Janos Stoika, represent for World Roma Federation. We are from ECOSOC, and I'd like to share some few information about for the Roma ethnic people. Probably the group has been so familiar with this, and under to the COVID-19 and for the vaccination and also for the health condition about for the Roma community. So most of them, what we like to be shares, we do a lot of research and also we part of for the SDG goals, which one we really like it, because always we're looking for part for the Roma community, how we're gonna be able to implement for the Roma people under for the SDG goals. Now, for under our knowledge and a lot of research what we already did, most of them, what the Roma community has been behind and rural area, especially for the Balkan area, which one is the health system is not really working. So most of them, the Roma has been impacted now for the COVID-19. And it's not just only for impact, it's also for discriminated as very well. So that's the reason we always be part of the UN program, because we like the side event either for any kind of connection, how we're going to be able to implement for the Roma community, how we're going to be built better. And so far, what is the problem for the EU territory? Most of them, what is the Roma community has been leaving. So pretty much is like that. And thank you for the time. The event is excellent. I really like it. And we like to be contacting in the future for anybody who's been interesting. Also, I've already posted for our website if there's anyone interested to know about more about for the World Roma Federation. And thank you for the opportunity.
Thank you very much, Janos, and thank you to all of those who have been able to share their views from different parts of the world. I think it really shows the breadth and diversity of the NGO Major Group. We've heard a number of different contributions just now, including questions around financing, questions around further inequalities for a number of key communities that are often left behind, including just now the Roma communities. We've also heard about the challenges around digital connectivity and the gaps that there are in terms of infrastructure. So I'd like to now go back to the panelists and to ask you each to give us just a few minutes of a concluding remarks from each of you. Feel free to respond to some of the questions that you've heard. And one additional point that I see in the Q&A from Dan Perel is thinking about the challenges that we've heard. What might be some of the solutions that you would be able to propose to help us move forward as an NGO community? So I'll just put back on the screen here a reminder of who our panel are. And perhaps this time we might go the other way. So starting this time with Ingrid, and then we can come back round the panel. So Ingrid, a couple of minutes for your closing remarks, please.
Thank you very much. And thank you to everyone who shared very important input. I think that as Dan touched upon in his question, there is no size that fits all. And we can see that different regions and different groups have different needs in terms of how to be able to take part in a meaningful way in a process. But we also have lately, as I touched upon earlier, realized that we can learn from seemingly very different processes in moving forward. And I know that in the plastics negotiations, we have learned a lot from disarmament. And it is quite a different thing to disarm than to remove plastics from the oceans. But we see that a lot of the the legal work done, but also in terms of involving communities and also those who will be paying the cost for the consequences of not having a ban is something we can learn from the landmines work that has been done for many, many years, but also how we are getting more and more aware, I think, of how important it is to do a proper analysis of who risk losing something when this process moves forward. And that is something that is, it's not unique to the environmental work, but it is very dominant in environmental work, that for us to be able to, as I sometimes like to say, save the world, but protect the nature, stop the climate crisis, stop the pollution crisis. If we are to be able to do this, we need to also know who will be paying the cost for stopping these crises. It is not a situation that everyone will win. If we don't do it, everyone will lose, but some will lose also when we do it. And I think that is a realization that we need to take with us. And also not just the powerful financial actors, industries, they will always make sure to have a seat at the table, but the local communities, the workers in plastics factories, the people who will lose their access to electricity if we stop having coal, all of these less obvious losers in a process need to be a part of the process. That is so important, and we need to keep an eye on that. And also I would just again come back to the need to share experiences and to be well coordinated. When we in the UNEP group are working on the theme for United Nations Environmental Assembly 5 is strengthening actions for nature to achieve the Sustainable Development Goals. It is pretty obvious that we should have conversations with people working on the SDGs. And we also know that if we can't stop the environmental crises we are facing, we won't be able to reach any of the Sustainable Development Goals. So everything is very closely linked. And I think that talking to each other, sharing experiences, and also becoming more aware of how our solutions, there's no quick fixes. We need to have solutions that take into account several problems. Digitalization is a good example. It's been raised here today. It can provide more access, but it also provides more tools to block access. It can make arenas easier to access, but it also provides people with disabilities, language barriers, digital infrastructure. You have all of these challenges that we need to focus. So always keeping in mind that there are no quick fixes, and that looking at the bigger picture and working on systemic change is key. That was a lot of things in a very short time, but I would like to finalize with thanking you for this event, and I'm looking very much forward to continuing the cooperation and also to follow the Unmute campaign. Thank you.
Thank you so much, Ingrid. That's great. And we certainly look forward to better coordinating between the NGO major group at the HLPF and the NGO groups at UNEP. So I think this has been a first step along that road as well. So moving on now, coming back to Sanjoy, perhaps you might also give us some of your closing remarks, please.
Thanks, Ollie. I just have 4 or 5 points, and some of them I'm sure our colleagues will pick up on or have reflected on. One is, this last year has been a learning in one thing, is that you can have all the weapons in the world, but you can't protect yourself from an unseen enemy, And I think that is one critical thing that we all need to come together on and actually urge. That defense budgets really need to be, where do you get the resources to do all this? You need to, countries need to reduce their defense budgets and spend more on health, spend more on education. These on justice issues. That's essentially one critical takeaway that I'm coming from, because several people have talked about the reduction of budgets, but are the defense budgets being cut? That's a question that we need to ask. And it is something that through the SDGs, the running theme is equality, peace, and all these issues, which lead essentially to the protection of rights. The other area that we need to look at is the question of mental wellness. This has become a huge issue in this time. People don't know how to cope. Children who are cooped up at home, parents who are cooped up with their children or with each other at home. There's so much to the digital world and Zoom that you can do. The simple gesture of connection, human connection, that is something that we miss. And I think it's really had a huge toll, not just the physical abuse and the trafficking and selling of people and the brutality towards them, but also the fact that people are having mental problems, mental wellness problems that they're not able to cope with. And I think that is the other area that we need to start investing in. We need to invest more in. And the money will come if you start reducing your budgets for defense and so on. Another point which I think, two other points and I'll close, is really the need for inclusiveness in policy making. It's something that's come up in several conversations. It's what I referred to, what Ms. Basu referred to, and others, is that unless you have communities involved in their own decision making, in their own future creation, you're not going to have a top-down approach that says this is what you should do, and therefore, this is what you need to do, and we'll make sure you do it. It's not going to work that way. Unless they are represented at the table, unless they have a voice in the process, we are going to keep making the same mistakes again and again, and especially for indigenous communities, for those who are traditional communities. I think this is very important. Otherwise, you have elites among these communities, oligarchies among these communities, and that's where community representation is really critical. The last point is the point that's been made about the digital divide. If you cut resources, if you cut the budgets which are actually creating more harm than good, which can destroy the world many times over, we're talking about one world, sustainable world, you would be able to end the digital divide because you would put resources into closing that gap and making sure that everybody has access. And I think that is really critical, because at the moment, the digital media is being controlled by people who abuse it, as well as by governments and corporates, not really enough by those who can make a difference in a better way. So I'm going to close here, and I thank you for this wonderful opportunity to be part of this process, and to listen to each one of those who have spoken and learn from each one of you. And I wish that all of you stay well and continue to be well in the months and years to come. Thank you.
Thank you very much, Sanjoy, and thank you for all of your insights and your very wide experience. It's extremely appreciated, and I think you've really brought so many different elements together in your closing remarks there. So if I might now ask Naeem next. We only have a few minutes left, so just 3 minutes, please. Naeem, over to you.
Thank you, Ali. One thing I've observed that everybody is focused on inclusiveness, and that is the main point. And I really appreciate what Ingrid concluded, and I'll not say more than that, but just to quote an example, that if you are going to work with an industry, for example, I was talking about the bricklanes. Bricklanes are a hub of climate related issues where 24/7 emissions are there. Then a huge number of animal workforce is there, a huge number of child labor, human labor is over there. And if you are an agency and you have your mandate on something and you visit over there and you say that, okay, ask the community what are the key issues and I'm here to support the human labor issues. But if they say, this is our animal, which whole of our family is dependent on, this animal is sick, can you help us? And the department refuses because it is not my domain. So this is one of the examples that we need inclusiveness, because losing an animal can be result of a disease, or can be a reason of anything else, but it can push people towards under the loans and many other human labor related issues. So I must conclude, like the climate change players, human health and human labor related organizations and animal health related organizations need to work together. And I must say UN may be able to play a role here to kickstart the negotiation process, where organizations should sit together to gather evidences on these One Health issues, and then come up with a joint action plan to address the issues of those who are facing these kind of widespread challenges, but need an inclusive approach. Thank you very much.
Thank you, Naeem. Thank you. And thanks for the reminder that we should continue to look at ways to work together and to connect those grassroots voices into these processes. We are running out of time, and I know that the official sessions will be starting soon. So I'd like to give the final words now to Fatimatou. Over to you. Fatimatou, s'il vous plaît.
Merci beaucoup, Oli. Merci également à tous pour les différentes interventions, les différents commentaires, suggestions. Moi, si vous permettrez, je vais faire un plaidoyer pour l'ODD6. Parce que quand on parle de rétablissement, de résilience post-Covid, nous avons tendance à penser aux conséquences de la pandémie à prendre en charge. Mais il faudra également reconnaître que cette crise a montré l'importance de l'eau par rapport à la santé de façon générale, au plan environnemental, au plan de la santé humaine, santé animale, dans la mesure où, comme l'a mentionné l'un des intervenants, ce sont des choses sur lesquelles nous n'avons pas de mainmise, mais l'eau quand même a un rôle à jouer en termes de gestion, en termes également de prévention de ces maladies. Or, il faudra reconnaître que les avancées par rapport à l'ODD6 sont encore lentes. Les derniers rapports des Nations Unies montrent qu'il faudra quadrupler le rythme des progrès annuels actuellement pour pouvoir atteindre l'ODD6. Donc, il y a un effort à faire en ce sens. Et les relations qui ont été montrées entre l'eau, la santé de façon générale, mais également les différents ODD, notamment par rapport à la pauvreté, par rapport au changement climatique, par rapport aux établissements humains, par rapport aux inégalités, etc., montrent qu'il y a nécessité d'agir, mais également il y a nécessité de travailler en synergie, de casser les silos, et que des efforts doivent être convergents par rapport à cet ODD6 pour son atteinte, mais également pour l'atteinte des autres ODD, en ce sens pour ne pas laisser personne en rade, comme l'a mentionné l'ensemble des intervenants. On a beau parler de progrès pour certains pays, mais il faudra reconnaître que voilà, il y a des communautés qui sont laissées en rade, et en ce sens, l'ODD6 doit être également au cœur des préoccupations politiques au niveau du HPLF, mais également au niveau des autres instances. Et en tant qu'organisation de la société civile, nous devons porter ce plaidoyer et agir en ce sens pour que l'accès à l'eau et à l'assainissement puisse être une réalité, mais également que ça puisse garantir tout ce qui est préoccupation de développement, mais également préoccupation de santé. Merci beaucoup.
Merci bien, Fatimatou. Thank you so much, and thank you for all of your experience. Clearly, this is a very, very strong panel, and it really does demonstrate the breadth of knowledge and the breadth of experience across the NGO major group. So I would like to close us off now by thanking again all of the panelists. We've had a very rich discussion, and thank you also to everyone else who's been able to join and be able to raise their points. We've heard also from the Swiss ambassador, who gave a very inspiring opening, and we know that the Swiss government has been supportive of civil society in a number of forums. We've heard from our regional OPs in Africa, in Latin America, and in North America. We've also heard interventions from a number of members from different parts of the NGO major group. This is still the beginning of the HLPF, and I'm sure you'll be joining lots of other sessions. So I've just posted in the chat a link to a calendar that we've collected within the NGO major group with some of the key side events that we're involved with. And I've also highlighted one of the side events that that I'm helping to organize on Thursday, also with the government of Norway, looking at inclusive VNR processes ahead of next week's VNRs. And finally, I think, as many of you will know, the official sessions are just about to start. And I've also just put the link there on UN Web TV. So if you'd like to watch the official sessions of the HLPF, they're freely available to anyone to watch. And there are some of our members from the NGO major group who'll be speaking on a number of those key panels in the official program. So I think we've certainly learned a lot together, and we look forward to continuing this conversation over the coming 2 weeks. I wish you all extremely productive 2 weeks at the HLPF. I'm sorry that we never have as much time as we would like, but we will continue this conversation. And I'd also like to thank the interpreters who have made this possible to ensure that we have linguistic inclusion as well. And thank you again to all of my co-hosts and co-organizers in organizing this session. Perhaps those of you who have cameras, we might all put our cameras on just to say goodbye, and until next time. Thank you. Merci.
Thank you, Ali.
Gracias.
Thank you.
Thank you all.
Thank you very much.
Bye.
Thanks, everyone.
Take very good care.
Bye.
Bye-bye.